Welcome back to Muscle Sense. My name is Sophia, and here we align your mind, body, and movement. Recently, I ran some online Zoom calls for those wanting to utilize their foam roller more effectively. And here we looked at using movement over the foam roller rather than rolling on the foam roller. I found that this technique is a lot better for sustainable change, and we're actually moving the tissues from the inside. So we're allowing the tissues underneath the layer of the skin. We're allowing the fascial tissues to move against each other. So if you're feeling quite tight through your ankles, but even if you're getting lower back pain, if you're getting any kind of back sensations as well, freeing up the front of the body first and working our way up to the hips is a really great way for you to utilize the foam roller to alleviate your pain. It's my mission here to help you create better change within your own body and utilize tools so that you are back in the driver's seat of your own body. Make sure you subscribe and comment any particular release that you got from this particular video. I'd love to hear from you, and make sure you click that notification bell so you never miss a flow with us. Side of your shin. Now you can choose either side, that's fine. But I want you to choose one shin and the front of the shin, and I want you to be on that meaty bit, on that tibialis anterior. I don't want you to be on the shin bone because it's quite sore. It's not effective there at all. So I want you to come gently kneeling over the top of the foam roller and placing your hands and really supporting yourself in a tabletop position over the foam roller. I want you to take a deep breath into your ribs. And as you exhale, I want you to relax over that foam roller. This is Gary, by the way. So I want you to find a nice tight spot at your tibialis anterior, and I want you to soften over that. Not too much tension here. To relieve the tension, you push yourself up off the foam roller. And then what I want you to do is start to use your ankle as movement here. So your foot, you're moving up and down, you're flexing up and down. You might start to do little circles or movements left and right. And if you're really in a lot of pain here, I don't want you to continue that level of intensity. It should be really soft here. So you're moving your foot up and down, and then you're moving the foam roller gently up or down. Either way is fine. So moving a few flexion of the ankle, up, down, and then move on to a different point of that muscle. So moving the ankle up and down, and then move along on that foam roller. It's almost like you're rolling up the entirety of that muscle. And just keep going up and down and moving that foam roller as you go. If it starts to get really sore as you get a bit deeper, I really want you to just move on. So it shouldn't be too intense here. So up and down and moving all the way up. That shin should be on that muscle. And if you're not already down towards the ankle, I want you to start to move down towards the ankle. And as you come down towards the ankle, you might need to shift your weight to the side, okay? Because if I come down towards my ankle, I'm more onto the shin bone. I need to be off the side there. So coming down, you might want to position your pelvis a little bit over to the side where you can still stay on that muscle and just stay off the bone. And then as you come onto the ankle, work your way down, all the way down to that ankle. And I want you to kind of sit on your ankle over that foam roller. It should be really gentle here. And I want you to try and gently start to move your foot left and right, okay? This is really, really super gentle across what we call the crural sock. It's around the ankle. It's just a really superficial bit of fascia. So applying pressure with your pelvis, moving your ankle left and right. Just really freeing up. It should feel like your skin is rubbing on the foam roller. And then come off and swap sides. So remembering being on that meaty bit, not on the shin, not on the shin bone, but on the tibialis anterior, which is the front muscle of your shin. Once you find a really nice spot, you want to take a deep breath and relaxing, sinking over onto that muscle, and then gently, gently start to use the movement of your ankle to free up the fascia. You'll feel it start to move underneath on the foam roller. Depending on the harshness of your foam roller, you might need to come up onto your fingers. Just alleviate that pressure. You don't have to go really hard here because you will be sore tomorrow if you go too hard. So start moving your ankle and then slowly moving the foam roller up. So it's almost like we're doing a slow motion roll all the way up that muscle. But we're getting the movement to move us there. We're using that movement to get all the way up that muscle. And you might want to come back towards the top. Just find where you feel the most tight and try and use your foot to move it a bit more. If you find a really, really tight spot, really sore spot, utilize your breath. You take a deep breath in and relaxing over it. And go back into those tiny little movements. So making your way down towards the ankle again. Try and move your way down there. As you come towards the ankle, you might want to need to position your pelvis over the foam roller so you stay on that muscle, not on the bone, not on the shin bone. And then work your way down to that ankle. And you're just trying to move the skin left and right. Should feel like you're rubbing the skin on it. It's exactly what we want because it's so superficial. This is really going to free up your ankle joint. It's going to help any back pain that you have. Ankle mobility is really important to help your foot operate well so that you don't load through your lower back. All right. Once we've done that, we're going to come up onto the quads here, so the upper leg. All right. So choose a side, any side is fine. I want you to come above the knee, so stay away from just above the knee. I want you to come into the meaty bit of your muscle, of your quads. All right. So lying gently on this quad, it can be quite intense for a lot of people here. So I want you to use your breath. So you're breathing in, and then you're softening into that quad. Now for me, I actually need to be up here. Being on my elbows is too much for me right here. So I'm softening into that quad with the breath. And now I'm going to slowly start to utilize the knee as movement. So I'm straightening my knee and I'm relaxing. Straightening my knee, relaxing. Tiny, tiny little movements here. And then once again, I'm moving that foam roller an inch. Straighten the knee, relax the knee, and then move the foam roller up just a little bit. And then as I get a little bit higher, I can actually start to increase the pressure by coming onto my elbows. So more of my body weight is over this because this is a bit of a bulkier bit of the muscle and it feels safe to do so. So straightening, relaxing, moving all the way up. So as you get up to the higher position, you might start to find that you want to target the outer quad, okay? Not quite on the side of your thigh, but just really off to the side, a little bit more lateral. What you want to do is you come from forward position, you just tilt your pelvis over and you're opening your rib cage just a little bit, all right? So it's almost like you're trying to get the outside of that quad and then try again with the movement. But if you're finding a lot of tension on the front of the quad, then stay there. You might want to come out onto the outside and utilizing that knee movement up and down. And then I want you to keep moving that knee, working all the way up to the front of the hip. All the way until you meet your hip bone. And what I want you to do is just for your sensation of your body, should be quite comfortable here. I want you to just feel your hip, the front of your hip and the bone. And I want you to kind of push your pelvis into the foam roller, just so you can visualize and you can really feel the front of your hip and what it feels like. Okay, so you should feel a little bit of a bony bit at the top, and then you might find a little bit of tenderness just below that bony bit. Once again, you're straightening your knee and relaxing just to free up this fascia. And now we're going to utilize the pelvis to move the front of the hip. So what I want you to do now is stick your bum out and then tuck your bum under. Tiny little tilts of your pelvis just over that foam roller. Okay. Now we're going to come around and to the side. I'm just going to swap sides here just so you can see. So we're still on the same leg. I haven't switched legs. You've come from the front of the hip. You're now opening your chest and you're coming around onto the side of the hip here. So what I want you to do is feel between your greater trochanter, so your femur bone, your thigh bone. It sticks out the side here, and then you've got the top of your pelvis. I want you to be roughly here. You'll feel it. It's can be quite tender. Okay. So what you want to do is now use your upper body to go in and out, going forward and opening up to the ceiling. Close down towards the floor and then up towards the ceiling. Okay, now we really want to stretch those fibers. So you're going to use your leg now. And you're going to straighten your leg that's on the foam roller and really try and stretch those fibers. So my upper body, I'm trying to direct my upper body this way and my leg goes that way. So these fibers get a nice long stretch. So you're reaching and relaxing. Okay. Just go at your speed. You don't have to go, it doesn't have to feel too sensationful here. This is just opening up the side of the hip. I'm going to come around onto the glute for those of you who've got tight hammies. So from this side position, just come and sit on your foam roller onto the glute. Okay, and the leg that's on the glute, on the foam roller, I want you to put that leg over your other leg. So you're crossing over. So for me, my right leg's crossing over my left, and I'm targeting my right glute. So just stay on the same side. And I just want you to move left and right. Just feel your glute. Try and find maybe the bones. You got your sit bone under there, and it might feel nice enough just to roll around here for a little bit. What I want you to do is grab your knee with your opposite arm, and I want you to move your knee up and down, okay? So you're moving around the foam roller. The foam roller is being utilised here. So up and down. It should feel relatively good. And then you can incorporate some circles, just incorporate some kind of movement here and really freeing up that side of that hip. And then as you come over onto sitting on that foam roller, we're going to get the top of the hamstring. So now I'm kind of sitting on the foam roller with my sit bone, the base of my pelvis. And I'm really trying to wedge the foam roller in between my glute and my hamstring under here, okay? So just straighten the leg that's on the foam roller. And now I'm starting to use my pelvis. Go really slow here, can be quite a little bit nervy. So I want you to stick your bum out and then tuck your bum under. So I'll try and exaggerate it here, but you don't need much movement here. You should start to feel the hamstring, the stretch in the hamstring. And if you can't, try and flex your ankle at the top here. So moving that pelvis tucking under, sticking your bum out. You might start to feel the stretch through there, just separating those fibers. And then rolling down, you might want to come sort of mid-thigh here and push yourself up with your arms. We're just trying to use some movement here for those hamstrings. Depending on what feels better for you, I'm not getting a lot of sensation here. So what I'm actually going to start to do is move my knee in and out. Rolling left and right over those hamstrings for me is a much better sensation. So if I give you something that's not quite working, just use a different movement. Try and feel into it, what feels better for you. So left and right, and then moving the foam roller onto a bit of the other bit of the hamstring. Left and right, and then moving on. So you might want to go between the two, straightening your knee and then rolling your knee. And moving on. Okay, once you finish that side, we are just going to check in with the body before we jump onto the other leg. Just feel that whole side and how much it actually feels, maybe a little bit more hydrated, a little bit more warm. That wasn't a lot of foam rolling, so you don't need much here. I just highly encourage you, if you've only got 5 minutes, just do 5 minutes of something. So now we're going to go into the other leg. Remember, it's staying away from the top of the knee. You're going to come onto the quad first and finding your position here. So for me, I need to be actually quite high as I begin this quad stretch and quad release because it's quite intense. So you're straightening your knee and then relaxing, taking a deep breath, softening into the foam roller on the exhale and relaxing. So moving that knee, straightening, relaxing, then moving the foam roller up just a little bit, moving and relaxing, and then just keep moving that foam roller and moving around that foam roller. The other thing is try the knee movement that you were doing with the hamstring. Try and do left and right. As you get up here, that might be a little bit better movement for you. For me, I enjoy the extension of the knee. So I'm just going to stick with that until I get a little bit further up. If you feel like you want to come back down to a little bit of a tighter spot and want to try and release a little bit more, then you can come back down, keep moving that knee, straightening, relaxing, left and right, whatever feels good. And then don't forget, you can actually utilize your upper body coming further into that movement by further into that pressure by coming and bringing your rib cage down and allowing more body weight into the foam roller. So working all the way up that quad, coming to the top of the hip, just finishing off that quad. Take your time there. Once again, feeling your pelvis, the front of your hips, the bony bits, really feeling, pushing that into the foam roller. This is just getting your brain connected to your body. Really just feeling the front of that hip. What does it feel like? Oh, there's a bit of a bony bit. Oh, that feels like a bit of muscle. You're just feeling what it feels like. And then we start to use the movement of the knee again, straightening and relaxing. Left and right with your knee can be quite good. And the pelvis, sticking your bum out, tucking your bum under. Really stretching out the front of that hip. So we're staying on the same side. But I'm just going to show you for viewing. So we come from the front to the side of that hip. And I'm just going to this is my left side, so it's quite sensationful, so I'm just going to get used to it here because I actually don't need a lot of pressure. It's my softer side, so it's a little bit more sensationful than I would like. So I'm going to utilize my breath. I'm going to take a deep breath in and then soften into the foam roller. It's a little bit harder for me to move this leg without it being tension in my body. So I don't really like this here, and it's almost too much. So I'm even thinking I'm going to lift my body up with my arm just to decompress or take that pressure off. And now I can start to move my leg. It's a little bit more comfortable there. So once we get moving, once it starts to get a little bit softer and my body says, okay, it's fine, it's safe, then I can start to come back down. We don't want to go in too quickly with fascia because it will tighten up really, really quickly. And then we're kind of fighting an uphill battle. So go really gentle at the beginning if you're doing any form of release work. So at the side of the hip, you're going to straighten that leg and think about lengthening the top of the rib cage. Bend the knee, extend the leg, and taking your ribs up away. So you're stretching out the side of the body. Okay, and then you can start to use your rib cage, left and right. Notice how your rib cage is actually moving your hips, okay? Rib cage is very important. If you're really tight through the hips and you keep trying to relax them and trying to treat them, and you're on the foam roller often, and you're trying to do a lot of hip mobility, perhaps what's going on is the rib cage is driving a lot of that tension. So working your way around to the glute, coming and sitting on the foam roller, popping your leg across the other side. So my left leg is across my right knee, my opposite hand on my left knee. And we're just moving the leg here, the femur, left and right. You can start to use your pelvis, stick your bum out, tuck your bum under, or start to use your upper body. Should feel just whatever you want to feel into here. It doesn't really matter where you move. We're just moving this fascia around. Okay, and then come around to the sit bone of the glute, which is the bony bit at the base of your pelvis. Okay, you want to sit between your hamstring and your glute, and you want to try and extend the pelvis. So stick your bum out, tuck your bum under, and try and really release through there. If you're not getting much sensation here, then really try and move your body so that you feel a bit more stretch here, including your ankle. So you can flex your ankle up here. And then as we move down, I want you to move down through your hamstring. So extend your knee, relax your knee, and then don't forget you can go left and right. It's like you're just wiping your hamstring over the foam roller. Left and right, left and right. Okay, moving your way down that hamstring. You might want to extend at the end there. That might get a little bit nice stretch there. Okay. So now we're going to use the hamstrings should feel a little bit better. We're going to start to utilize the adductors on the inside. It's really going to open up your hips there. I'm just going to move this dog. Come on. Out you go. Go on. So, try and see if I can get a bit side on here. We're going to utilise the foam roller on the inside of your leg. So I'm going to get myself into a relatively comfortable position, lying sort of on my side at the beginning. I'm simply going to place my leg on the foam roller, and it shouldn't feel like much at all. It should feel quite comfortable. I'm staying away directly from the top of that knee, just because there's a danger zone there and it's not going to feel very good. And once again, this is a quite sensationful area. So what I want you to do is utilize the breath again. Take a deep breath in and then relax. over that foam roller. And now we're going to start to extend that leg that's on the foam roller. Extending and relaxing, extending and relaxing. Once again, working the foam roller all the way up with the movement. This is really gentle at the beginning. If it's too sensationful, use your upper body just to take that pressure off. It shouldn't feel overly sensationful. And I'm working all the way up to the groin. And as we get up closer to the groin, it shouldn't feel sharp, pulsy. If it does, move away. All right. So extend and relax and extend and relax. I think we've lost a few people. It might be thunderstorms. It's raining out there. So you might have found on your exploration up the adductor, on the inside of the thigh, you might find that there's a bit of a tighter spot than most of the other areas that you found. So what I want you to do is use your rib cage. You're going to come down, you're going to lie on your tummy. You're going to try and relax your head, okay? You're going to find a nice sensationful spot, and I want you to utilize the breath again. You're going to take a deep breath in and then relax. And now either use your pelvis or your leg to stretch that area. So if you want to use your pelvis, you're going to stick your bum out, tuck your bum under. See what that feels like. It might feel good and feel like it's releasing things and moving, or you can start to use your knee, but really gently with the knee. You don't need to extend much here to get movement there. So breathing, try and keep your upper body relaxed. Relax that head if you can. And then work your way up towards the upper adductor, towards the groin there. Okay, one more deep breath and then relax. Finish off that part of the adductor that you're doing, and then we're going to swap sides. So once again, try and really slowly here, relaxing over that adductor. You don't want to be too firm initially. Remember, fascia likes really slow, kind and gentle touch to begin with. We can get in deeper later. So taking a deep breath in and then relaxing. And then start to move that knee, straighten that leg, relax, straighten that leg, and maybe even bend the knee a little bit more. And working the way up towards the groin. You might want to come back down again, straighten, relax. Once again, if you get towards the groin and it's sharp or pulsy, you just move away, move off, okay? So now we're going to go a bit deeper. So we're going to use the rib cage to fall forward onto those adductors. Find a really nice spot that feels quite, sensationful, and I want you to take a deep breath. Relax your body over it. And then start to use your pelvis or your knee to utilize that movement. Right, so I'm straightening my knee, and then I'm also going to use my pelvis, stick my bum out, tuck my bum under. Really finding my own position. I'm actually going between the two of them, so feel what's best for you and your body. Okay, working your way up towards the groin. Once again, if it's pulsy or nervy, you want to move off it. Nervy being shooty pain, electric pain. Taking another deep breath in and then relax. And straighten and relax your knee. Finish off that part of the adductor, and I want you to come onto your back. Take your time if you're finishing. I want you to come onto your back when you're ready. Face up, your palms are face up. Your feet are planted on the floor. You're just feeling into the sensation of your legs. They might feel a bit buzzy. They might feel a bit warm. They might feel a bit hydrated, hopefully. So you're externally rotating your arms. Your palms are face up. Just close over your eyes. Take a deep breath in. It's almost like you're breathing into your legs. You're accepting all of this change. And then exhale. It's almost like you're deflating on that exhale. You're letting all that tension go. Take another deep breath through the nose. And then exhale. And one more. Deep breath in. All the way down into those legs, accepting that movement, accepting that change. And then exhale. Deflate your body. Fully exhale. And slowly, slowly roll yourself up.